And welcome to the show. Subscribe at
Thank you.
kevinmd.com/podcast. Today, we welcome Alisa Berger. She's a urologist. Today's Kevin MD article is Why Doctors Must Take Charge to Save Our Failing Healthcare System. Alisa, welcome to the show.
Thank you so much for having me.
So let's start by briefly sharing your story and journey.
Okay. All right. So I knew I wanted to be a doctor since I was about 12. And then beyond that, I thought, oh, of course, I'm going to do primary care. And I get to med school. And at that time, you still did all the lectures first, then you do your clinicals. So I said, okay, well, I think I'm doing primary care. So I have to choose 4 surgical rotations. So the first 3 I chose, I knew I wasn't going to do because they're high intensity and high call. And I knew I wanted to be a mom as well. So I did trauma, cardiothoracic, and neurosurgery. And then I had to choose a 4th. And so I kind of randomly threw in urology. And then I realized, hey, these are kind of the laid back surgeons. And as people often will say to me, and sometimes I seem like it's a little judgy and sexist, why did you go into urology? The point being, it's a great specialty, big open surgeries, small little things, and there's a lot of continuity of care, more so than in other surgical practices. So that's why I chose that, and not to mention the lack of crazy emergencies. Usually you can handle them within 24 hours, not 30 minutes. So that's why I went into it. I did a 6-year program in Connecticut, and then found myself wanting to go to a smaller city. And for the reasons of as being a female, if I went to a bigger city and didn't already have a fellowship training specialty, my practice would just kind of turn into an all-female practice. And I wanted to do general urology. So I was in a small town solo practice for a decade. Mm-hmm. And that did turn my kind of niche into BPH. And when I was about 40, still in this town, I realized that I still have half of my med school loans, and I'm getting paid less each year. So I got to see more people, and that doesn't counteract the inflation. And of course, you want to give your good employees raises. And that goes back to what I put in the article about, somebody can earn more money at Buc-ee's than they can being an MA for me. So that was a struggle, but I still loved what I was doing. I wasn't going to change it. And then for family, my kids' schools, and my husband's career, said, okay, well, now we're going to move back to my hometown. And I was employed for 2 years. Thought I was going to like that as a change, but not so much. And then at that point, I wasn't going to move again. So since 2019, I've been doing full-time locums. So I just travel to work. And when I'm home, I'm home, which is pretty nice, especially originally I had 2 kids at home. Now I just have 1. So having some time with her is wonderful. And of course, being able to hang out because I do have a spouse that I actually like. So that's good. And that's kind of where I'm at, still doing locums at this time. And that's my little story.
All right. You wrote this Kevin MD article, Why Doctors Must Take Charge to Save Our Failing Healthcare System. Now, before talking about the article itself, what led you to write it in the first place?
So I am big in advocacy as well. I'm part of both the Texas Medical Association and the American Urological Association. And in order to be a part of medicine, you have to, or at least have a say in medicine, you have to be part of advocacy. Yeah. And so in those things, I kept feeling like we're out here trying to really just make our ability to practice feasible and take care of the patients how we want to take care of them. And no one's really listening to us. They're making all these rules. And to me, it was lacking some common sense. And then it really, as many things, turns into money. And I felt like I wanted to both point out some of what I think are some common sense problems with our system. And then I actually had a second article that was somewhat of a follow-up, because my first one was, here are the problems. Mm-hmm. And I didn't want to just point them out and not try to be a part of the solution. And so the second one was more like, here's some more controversial, hard things to talk about and think that maybe we need to take these steps in order to make some improvements in the system.
All right. So tell us about the article. What are some of the problems as you see it with our healthcare system?
So I feel like the problem is money. Everybody wants a piece of the healthcare pie. And right now, the people who have the most are the drug companies and the insurance companies. And the inordinate amount that they pay their CEOs is just mind-boggling, when we're just unable to allow the independent practitioner to even continue to practice. So that's frustrating. And those are the things that I was pointing out. And then something that people don't always think about as well is administration in healthcare. There has been an inordinate amount of increase in basically the middle layer, or the administration. And I'm not so sure that's needed. And part of that is because our healthcare system has become so complicated, and we have to jump through so many hoops in order to adequately get paid by our insurance companies that if we had simplified the process to begin with, we may not need all those layers.
So when you were in private practice, and as you know, there is a declining percentage of physicians who are in private practice these days. Tell us about how some of those challenges really impeded how you could run that practice. And you mentioned earlier about how you couldn't pay your MAs enough, couldn't keep good people, but go into more detail. How did that affect your professional life as a doctor in terms of the difficulties running that private practice?
Just makes you disheartened. Within the first couple of years, I never thought that I would not take Medicaid patients. No, of course, I'm going to take those patients. I'm not going to turn patients away. But after 2 years, it just became too difficult. And that's because, unlike Medicare, which isn't the best system, but actually pays better than Medicaid, is tolerable and you can still make a living. Whereas Medicaid, you were losing money every time you saw one of those patients. And if you're an independent practitioner, you don't have any cushion to absorb that loss. And so after a couple of years, I stopped seeing Medicaid. Now, of course, I took care of them in the hospital and I would do their follow-up and those type of things, but I didn't take new patient Medicaid because I just couldn't afford it.
Now, you mentioned it. You are a member of the American Urological Association, the Texas Medical Association.
Mhm.
So, in terms of advocacy effort by organized medicine, how are they pushing back against the influence of money in medicine that's making the job of physicians harder?
Well, I think we can be doing a better job, but certainly the TMA with the AMA is really honing down the point of how for the past 2 decades, everybody has gotten a pay increase except physicians.
Mhm.
And for the 2025 year, or in going into the 2025 year, looking back at 2024, the inflation rate has been matched by increases for inpatient, outpatient, hospice, surgeon centers. But for physician pay, it's only been a negative. So getting that information out there, I think it's helpful because yes, we make a decent living. I mean, I wasn't going to stop practicing unless I couldn't make a living. And so it's hard for physicians to always be the people out there saying, hey, we're not making enough money. I mean, the average person doesn't take that very well.
Mhm.
But when now they're starting to see their favorite family practitioner or their favorite doctor can't continue to practice independently, and now they can't go to them, they're recognizing, hey, yeah, this is an issue. And so our ability to communicate to our patients, hey, look, we're not really just asking for more money for us. It's so that we can stay in practice and pay our workers and run a smooth and efficient office where you don't get so frustrated because you call the front desk and they never get back to you or they're rude or whatever it is because we can't afford to pay them enough to keep the good ones there.
And do you see that particular message to patients? Do you see that resonating?
Yeah, I think at this point, because so many patients are frustrated with both the lack of face time with
Mhm.
their physician and then the inability to see them in a timely fashion or the particular doctor they want.
So I mentioned earlier about the decline in independent physician practices. So why don't you comment on that? Because you had a private practice yourself. What does it mean for the physician profession as a whole that the fact that less and less of them are opening up private practices?
Well, our autonomy is shot in that case. When we aren't independently owning our practice, then we're always beholden to whoever is employing us. And that comes with its own constraints. And once you are sort of enveloped by that system, it's almost impossible, unless you're independently wealthy or take out a lot more loans, to detach yourself from them. And as time goes on, it can erode your ability to set limits or, certain requirements and say, hey, I really need this to practice good medicine. And so we just have less of a voice or leverage.
So you also talked about a lot of middle people, a lot of administration. It also impedes how we care for patients. So what are some proposed solutions? So if you were the healthcare czar, how would you go about fixing this?
Well, it always comes back to money and not having enough of it. And our system will implode. I am worried, within the next 10 to 20 years. And so something's got to happen. Uh, I feel like not only from a humanitarian aspect and ethically is it right to ensure that everyone has some basis of healthcare insurance, that monetarily it's smart too. These people are showing up in the emergency room and getting the most expensive care at a more acute setting that could have been provided in a cheaper fashion and much more preventative nature, which has always been shown to be cheaper.
So, as you know, so many approaches when it comes to that. Are you in favor of more regulation, more government intervention? As you can imagine, across the political spectrum, there's a lot of approaches in terms of addressing what you describe. So, which approach or which types of approaches would you prefer?
To get into the specifics, I don't have that magic wand and I'm not the czar, but I do think that the first step is getting people to not be so partisan about the issue and not take providing universal care as this leftist communist agenda, because we're really the only nation in our world that is a sophisticated society that doesn't provide some basis of care. So, and not all the rest of them are communists. so getting past that misperception, I think, is important, and allowing people to recognize, hey, we're already paying for car insurance that we are mandated to do if we want to own and drive a car. So for me, it's where's the outrage about that if you're going to have so much outrage about healthcare? So getting past that and quitting the whole partisan part of it, I think, is the first step. And then really talking about, okay, is some sort of expansion of Medicare appropriate? I don't know. Is there some more component of getting private entities to improve? And I just get concerned, and that brings in the private equity part. I definitely am not a fan of private equity in medicine, from the standpoint of the whole goal is to both invest, which is good, but improve and then turn around to make a profit in a short time. So 5-7 years. I mean, if you look up the definition of a private equity firm, I personally don't think that's good for healthcare. Now, I do know one person that has been super happy with their private equity firm taking them over because they really did invest in the things and listen to the doctors on what they needed. That's still yet to play out there when they want to sell and make their profit. So also realizing that our system can't be out there to provide profit to every entity, but we just kind of need to get the greed out of healthcare.
And in terms of doing that, are you advocating, like you said, expansion of Medicare? More government involvement would have to be the case if we were to get some of that money out of healthcare.
You're right. I mean, the government does have to be more involved. And if you look back at the ACA or Obamacare, as we want to partisanize it again, I think it was not implemented well, which gives everybody a bad taste. But there are two things people really do love about that, and that is the keeping kids on until 25, and then most importantly, not excluding people for a pre-existing condition. That was very important, and that's one of the successful things from that implementation. I agree the rollout was pathetic, but I think steps like that are actually going in the right direction. And again, trying to remove the partisan component of that and really just look at the big picture of, we're physicians, we're just trying to provide good care and also make a living without being controlled by those intermediate levels or basically the drug and insurance companies.
So, through your advocacy efforts, you mentioned, of course, that physicians need to play a role in terms of how our health system evolves. Give us an example of how physicians move the needle from what you observe through the TMA and the American Urological Association. What's an example of how physician involvement can improve the care and remove the obstacles that prevent us from giving the best care to patients?
Well, unfortunately, it requires talking to our politicians who control the purse strings to some degree of that. And I've gone to both our Capitol in Austin and done what we call our First Tuesdays, white coats. We wear them and go talk to our congresspersons. And then with the AUA, I've gone to DC and we go and walk the halls of Congress and advocate for our practices, but more so for our patients. And so those are the steps, which, you know, I am a little bit of a political junkie in the sense of I like politics, but to some degree it can be a necessary evil just to be able to practice how you want. So those are the actual steps. And unfortunately, that involves money and contributing. But you don't always have to give money. You can still let them hear your voice and write them a letter, show up at their office. Those kind of things are literal steps that you can do.
And when you do that, do you feel politicians listen to you?
They do, some more than others. And it's funny, they say, don't worry if you don't get to actually speak to the congressperson. But if you get to speak to their health policy aide, that's even better because that's the person that's helping them choose that, which is also mind boggling to some degree because typically those people are in their 20s who just moved to DC and making minimal money. They do have some knowledge, but these are the folks that are feeding our politicians information. So we need to do our job with our actual experience in medicine to educate those people and respectively their politicians.
We're talking to Alisa Berger. She is a urologist. Today's Kevin MD article is Why Doctors Must Take Charge to Save Our Failing Healthcare System. Alisa, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Okay, the biggest is just be an advocate for yourself and your practice, and that means getting involved with larger groups like the TMA or the AUA. That really is important. I mean, a lot of people are super busy and feel like that's not an issue, but unfortunately, your voice has to be heard with money, and that's going through politicians. And so again, you don't have to give all your money away, but you just need to show up and talk to them and have that conversation. So if you can't physically be there to do that, then it does require some support with monetary contributions.
Alisa, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Yeah, thanks for having me. It was a pleasure.